Hi everybody, my name's Heather Knox, Chief Executive here in NHS Lanarkshire. I'm going to cover a few things today. I'm going to start off just by talking about where we are in terms of our COVID numbers across the hospitals. I'm going to talk about vaccinations. I'm going to talk about the way forward, and then I'm going to give you some updates around our online version of Pulse, which is coming very soon. So if I start off just by talking around our COVID numbers, we've now got 52 inpatients across the 3 acute sites, so that's a huge improvement on where we were at the middle of January, and very welcome news. We're still seeing about 90 to 100 new cases every day, but I think that's largely due to a slightly higher level in Lanarkshire because we're doing so much asymptomatic testing, so that's quite positive in some ways. And it doesn't feel as if those cases are now translating through into inpatient admissions, so that's good news, I think. The other really good piece of news is that we now only have 2 active outbreaks within our 90 plus care homes across Lanarkshire, and that's a vastly improved position. So good news in terms of COVID. In terms of the vaccination programme, we covered 250,000 first vaccinations this week, so that's a huge landmark. We have to vaccinate 500,000 people twice, so we've got to deliver 1 million vaccinations. So to have got to a quarter of the way through is really, really good news. So the people that we are going to vaccinate, those 500,000 people, we need to vaccinate them by the middle of April. And I'm pleased to say we're actually on track, vaccine supply allowing, to get through those cohorts by the end of the month. So a huge thanks to everybody involved in vaccination, all the staff. We've got 1,000 staff delivering vaccines across Lanarkshire. And I'm really grateful to all of them for all the work, and everybody that has had a vaccination has said how polite and how special they made each and every patient feel when they were getting their vaccination, so thank you for that. Thirdly, I wanted just to say it's great to see some media coverage of baby Peyton. Those of you that have watched these wee video clips regularly will remember I talked about baby Peyton a year ago, because baby Peyton, unfortunately for her, was COVID positive in Wishaw Hospital right at the beginning of the pandemic, so a year ago. But I'm really pleased to say that she looks happy and healthy, and the family look delighted to have her around, so it's so lovely to see that, and we send that family our best wishes. Fourthly, today I want to just say a wee bit about resetting. So we've stepped down a bit of our Gold Command structure. We are still meeting as a Gold Command team, but we're doing it less frequently now here in board headquarters. And we need to kind of reset things and start to move forward now, hopefully on that road to recovery. So we're starting to think about some of our more strategic delivery issues, how we will recover those patients who've been waiting, and how we will work going forward to tackle things like well-being and mental health and inequalities across Lanarkshire. So some of the issues that have been there before but have really been magnified through this pandemic. So keen to get going on that with our partners going forward, and lots of work to do there. Finally, just wanted to say that my comms colleagues are reminding me to let you know that the paper version of Pulse that you used to see is no longer, and that will go online from next week. So those of you that like to have a look at Pulse, the way that you can get access to Pulse from next week will be online. I'll finish up just by saying thanks to everybody again. Thank you.